Imagine you had your first shot of the Covishield vaccine and now you're ready to get the second shot. You book an appointment, stand in the line, and then realize you cannot get it since there are no Covishield vaccines available. But they have Covaxin. So you missed your second shot. What next? Can you get Covaxin as your second shot now? Will this work? Will you have side effects? Or should you just give up on getting the second shot because it is so difficult to get it? Or should you just start all over again? You're not alone with this problem. In fact, many people have been through this. Bollywood actress Suchitra Krishnamurthy had a similar problem and she actually tweeted about this. In this video, you will find answers to all your questions from a public world health expert, Dr. Ajay Kumar. Dr. Ajay is the Director of Operational Research of the International Union Against Tuberculosis and Lung Disease, called the Union. Union is the world's first global health organization founded in 1920. He is PhD from Netherlands. He has served as a consultant to WHO India for tuberculosis. Without further ado, Dr. Ajay, welcome. So you may be muted. So if you want to unmute yourself. In the meanwhile, I want to welcome those of you who are live and also our returning viewers. If you're new here and still not subscribed to the channel, I encourage you to subscribe and hit the bell icon so you get a notification when a new video is released. I'm Dr. Raj and I work in the USA. This is Health for Kiddies, where we show information that is evidence-based, or in other words, it is scientifically tested. We don't just provide education, but create health and wellness for you and your family. Check this link for other videos on COVID, and I have left in the description below right here. All right. If you want to unmute your screen. All right. Are you able to hear us?
Hi, Rajiv.
There
Hello.
you
Hi,
go.
everyone.
There you go. All right. That's excellent. There is always some or the other technical glitch. Well, I want to remind you all to post your questions in the comments below and we'll try to get to them as much as we can. So let's move to Dr. Ajay. So Dr. Ajay, thank you for being here.
Hi, Rajiv. Yeah.
All right. So in the USA, the Center for Disease Control says, in quotes, in exceptional situations in which the mRNA vaccine product given for the first dose cannot be determined, or if it is no longer available, any vaccine can be administered at a minimum of 28 days between doses to complete the vaccination series. So tell us, Dr. Ajay, what should people do in India when they cannot find the second dose of the vaccine?
Yeah, I think we are starting with one of the trickiest questions on COVID vaccination. I think the key word in what you said is exceptional situations. Yeah. So when I look at global guidance, whether it is from World Health Organization or even CDC for that matter, UK Public Health England, or even the Ministry of Health in India, I think everybody says interchangeability of vaccines is not permitted. Yeah, because just because there is no evidence in support of the same. Although in principle it may work and it may work better, but we do not have data to support this strategy. Yes, of course. In exceptional situations, as one of the situations that you described, like you got my first dose, but come the time for second dose, and that particular vaccine is not available. So then, what to do? Yeah. So I think first you must delay the second dose as much as you can. Okay, whatever is permitted. Yeah. For example, I think with mRNA vaccines like the one by Pfizer or Moderna, you can delay up to 6 weeks, so you can do that. And with the other vaccines like Covishield, you can go up to till 16 weeks as per the new recommendations. So you delay as much as you can and try and get the same vaccine, yeah, for the second dose as well. But let's say you did all that and still it is not available, probably in such exceptional circumstances. Uh, I think CDC recommends that, let's say you've got Pfizer as your first dose and Pfizer is not available, then you go for Moderna as the second dose. Yeah. This could also be a consideration. I was thinking, for example, if somebody develops allergy to the first dose of the vaccine, yeah, no
Okay.
matter what the vaccine is, then
Okay.
it's clear that we cannot give the second dose of the same vaccine. So it will have to come from another vaccine.
Mm-hmm.
Yeah. So I think practically, and with we are trying to vaccinate the whole world here, and it's going to be a logistical nightmare for sure. I'm not sure if we can have all the supply chain management issues ironed out very clearly. So these are expected. So and but as I said, until we get more evidence, we cannot, at this point in time, I think the recommendation still remains that interchangeability of vaccines is not permitted. But just want to say that studies are ongoing and it's not far away, maybe another 3 months or 4 months before we'll have a clearer picture. I think there was one interim analysis of a study got published last week, which showed that if you use different vaccines, then there is a slight increase in incidence of short-term adverse events compared to using the same vaccines for both doses. But as I said, these are early days, and until one is, of course, safety, but the other thing we have to look at is whether they work or not in terms of protecting people from getting infected. So I guess we'll have to wait. Yeah.
Okay. So I guess many of our viewers are not doctors. So I think to just to put it into lay language, I think the message is do not take any other vaccine, at least as of today, except in exceptional circumstances, which you don't decide, but let your the hospital or your doctor or your healthcare system decide if it's an exceptional circumstance. But for the most part, just stick to the same vaccine that you took, unless the scientific testing changes in the near future. Hopefully it does, because as you said, there are a lot of studies that are ongoing, and
Hmm.
as of today, 3% of India is vaccinated. So which means that there is a lot more number of people who needs to get vaccinated, and shortage is definitely a problem. All right. Um, so
Just wanted to add, I mean, recently in India also we had, mix up in Uttar Pradesh. About 20 people got, I think, Covishield as their first dose and Covaxin as their second dose. And yes, it is definitely a mix up that happened, and they were monitored, and of course, there were no adverse events. But this is going to be a problem. And I think the other question people may ask is, okay, I got my second dose as Covaxin. Should I now take the either after 4 weeks take another dose of Covaxin to complete that schedule, or take another dose of Covishield to complete that schedule? I think these are answers which are not clear. But generally, I think the guidance is that you've had two doses, probably nothing much more is needed. So you simply wait. Yeah.
okay. So, just on the same question. So, let's say someone had their first shot and now they're waiting to get their second shot. Now let's say the time for second shot is over. So what should they
Yeah.
do? Should they start all over with a different vaccine, or should they just get the second shot whenever they can?
Yeah, as I just said, for example, let's say you got the Pfizer vaccine as the first shot, and then by the time you come to the second shot, Pfizer is not available. So, what CDC currently recommends is in such exceptional circumstances, maybe you take a Moderna vaccine, yeah? And but then you don't go for the second dose of Moderna or Pfizer again. So they currently recommend, okay, you had two doses, you stop there. Or in certain circumstances, if you maybe there's something about mRNA vaccines that you are allergic to, so you got the first vaccine as an mRNA vaccine, but the second vaccine is, let's say, a Johnson and Johnson vaccine. Then you just take that dose, and then of course with Johnson and Johnson it's easier because it's a single dose. It's one of those vaccines which has only a single dose.
Mm-hmm. Mm-hmm. Okay. So the other thing is, how long after the shot does vaccine provide protection, and how long do you think it lasts? Is this the same with all vaccines?
Yeah, this is other question again. We do not have clear answers, and I was just checking if there is any more evidence, but unfortunately, from I gave a webinar last week. It was similar. The status is similar. So currently, we do not have enough. So most of the vaccine studies which have happened, I think the follow-up period is anywhere between 6 to 9 months now. So we may get further follow-up data to show to what extent these vaccines continue to provide protection and how long they last. But it's about 6 to 9 months. I could put out my head and say, but as of now, there is no sort of concrete data to say how long they provide protection and how strong is the protection. I mean, does it wane as the time goes? Of course, is it the same for all vaccines? Again, not sure at this moment. We do not have well conducted studies for us to make a conclusion here.
Okay. Well, so this is a new disease. This is a new vaccine, so everyone is learning about it. So let's take,
Yeah.
I have a lot of questions, but let's take some of the audience question. Like, let's see if I can
Oh, great.
put this on the screen. Uh, anyway, so let me read it to you. A
Okay.
question I see is, how many days gap is required between first dose and second dose of Covishield?
Yeah. Okay, thank you. So I think the latest recommendation says 12 to 16 weeks in India and everywhere. So I think in the initial studies they did, they tested 4 weeks, 8 weeks, and 12 weeks. And what they observed was that if the duration between the first and second dose is much higher, then the protection is much stronger. And this is one of the reasons I think the latest recommendation is that you can give the interval between the two doses can range anywhere between 12 to 16 weeks. I think from an operational consideration also this is good because then you are able to reach a larger proportion of the population with at least one dose of vaccine, which will provide some protection and if not the peak protection, which will require both doses and 2 weeks after that. But operationally also it will ease the logistics a little bit. Yeah.
Okay, so I do see a comment that says very useful information about swapping of vaccines, especially for Indians who sometimes rely on vague self analysis.
Okay.
Okay, all right. So let's see. So we know the story of Dr. K.K. Agarwal, who is the former, president of Indian Medical Association.
Right.
India Today reported he had two doses of vaccine in February and succumbed to COVID a few months later.
Mm.
Well, for the viewers, I've left the link in the description below of this news. Well, second is the legendary Tamil actor Vivek, who passed away and he had received COVID vaccine. Although his death was not because of COVID, vaccine hesitancy grew in Tamil Nadu. So, what do you think? So, should people get vaccinated? What advice do you give people to increase their confidence in receiving vaccine?
Right. So I think first let's clarify Vivek's case, because I think, as you said, his death was because of a heart attack and not really related to COVID. So nothing related to COVID vaccine as well. But Dr. Agarwal's death was due to COVID. And it is true that he had both the doses of vaccine and still succumbed to COVID. So should people get vaccinated? Well, so vaccination is one of the most effective public health interventions that we have to battle against this COVID-19 pandemic.
Mm-hmm.
And not only provides individual protection. Yeah, of course, it's not 100%. That is very clear. I'll come to that. But it greatly reduces the risk of severe disease and death.
Mm-hmm.
Many people ask me this question: is it 100% protective? Nothing is 100%. No vaccine is ever 100% protective. I think when we look at the studies, the efficacy of vaccines vary from 66% to 95%. So there's a whole range here. But the important thing is this vaccine efficacy is preventing infections. Now, if we change the question, how efficacious these vaccines are in preventing severe disease, hospitalization, and death, and suddenly you will see that efficacy of all the vaccines cross 95%. Of course, it's not 100%. You will find, unfortunately, some people still, in spite of all of this, not getting the required protection and succumbing to the disease, go on to hospitalizations and death. But that proportion is very, very low. I mean, should people get vaccinated? Of course. This is the most effective intervention that we have and the most important tool we have in the fight against COVID. So let me just clarify why do people get infected even though they have been vaccinated? There are three things. One is vaccines are not instantly protective. Okay, so let's say you take the vaccine today and tomorrow it will give you a protection. No. It takes a while before it gives you protection. You require 2 doses, and 2 weeks after the second dose is when you achieve your peak protection. Okay, so if you get infected any time in between, it is possible for you to get infected. Or let's say you got infected before you took the vaccine. Let's say 3 or 4 days before you took the vaccine. That cannot be prevented by vaccine. And the third point is vaccines are not 100% protective in preventing infection, but in preventing and reducing the risk of severe disease and death, it's more than 95% effective. So that's why it's very, very important that all of us get vaccinated at the earliest possible opportunity.
Okay.
I think I saw some news report, Rajiv, about yeah, so many deaths among the healthcare workers in India. This was again that came out from Indian Medical Association
Yeah.
about 250 or 300 plus deaths which happened among the medical fraternity.
Mm-hmm.
And one of the interesting piece in that, of them, only 3% had full vaccination.
Yeah, I saw the news.
97% of those who died either did not get full 2 doses, 1 dose, or not vaccinated at all. Again, giving a clear indication about the effectiveness of vaccine in preventing severe disease and death.
Yeah. So that's very helpful. I think to summarize, people should get vaccinated. That's the best thing we have right now. Of course, nothing is 100% protective. Just stay safe and do get vaccinated as soon as you can. All right.
Fine.
Moving on to the next question. I'll try to add it on the screen. I'm not sure if you can see it. The question says, if a person is affected and positive, when should be the first vaccine taken? Is it with the day of is it with the day of symptom or day you get retested and get negative?
Okay, so this is a question. I've got already COVID infection. Should I get vaccinated or not? Yeah, this is one of the common questions people have. Uh, yes, so one of the things you should understand is that if you are already COVID infected and on the path of recovery, infection itself provides some immunity. Yeah, so there's no hurry to get vaccinated. And I think overall the recommendation is that at least for the initial 3 months after you recover, there's no problem. You still have enough immunity. So maybe after 3 months, after you've recovered from infection, you can go for the vaccination, and then it will act as a sort of booster to strengthen your immunity, which you have already acquired due to infection.
Yeah. So I have a video on the COVID timeline and when to get investigations done and what to expect, and do check in the description below. All right. So I have the next question on the screen. If you can see it, I'm going to read it for you. It says, I had got infected by COVID 19 30 days ago. 10 days back, I tested negative, but I still have severe neck pain. Is this due to COVID 19?
Yeah, I think there will be some residual symptoms. I'm not sure if neck pain is one of them, but I've often heard people having, mild cough, dry cough, which sort of nagging and prolongs for a long time. So it takes a while for a full resolution of symptoms. I've never heard neck pain being one of them. So you must consult your doctor to find out why that happened, yeah, and how to deal with it.
Yeah, so to add to that, I think so far the symptoms that I'm aware of are symptoms that are very similar to COVID infection. So if this is something very new, as Ajay said, you may want to just check it out to make sure everything is okay. I have another question, so which is a good one actually. Does COVID vaccine prevent us from black fungus, white fungus, etc.?
Oh, okay. Yeah, so I think these fungal infections that we are seeing is because of centrally because of COVID. Of course, there are other risk factors, and there are many hypotheses running around. One is, of course, steroid intake, uncontrolled diabetes. This, we would call it as sort of a holy triad that we see, but there is a lot that we fully don't understand why there is sudden increase in incidence of fungal infections among people who are recovering from COVID infection. So this question is, you're asking, does COVID vaccine prevent us from black fungus? Of course, because COVID vaccine will prevent you from getting COVID in the first place, which is a central player, in getting other fungal infections. So if you don't get COVID at all, then obviously all the complications of COVID, will be prevented. So again, vaccine is one of the best tools we have. Go for it whenever you have it.
Okay. So I think to answer that, so COVID vaccine does not directly prevent any fungal infection, although it does indirectly prevent because it prevents COVID infection if that were to be the cause of the fungal infections. Um,
Well summarized, yes.
I will move to the next one. Again, so the question is, I was about to ask this question later, but we might as well ask this. So, USA has noted a few heart problems like myocarditis or inflammation of the heart with vaccines. And also, on the same note, there is a question that says, is it true that few people having heart attack after taking 2 doses of vaccination? So, can this be a risk with the vaccines in India, like the myocarditis or heart attacks or any heart problems?
Yeah, I think I also saw that. I think from whatever vaccine related adverse events have been reported till date, especially in USA, I think more than 160 million doses of vaccines have been given. and there have been a few cases of myocarditis, which is essentially inflammation of the heart muscle, or pericarditis, which is inflammation of the outer lining of the heart. These have been reported, and this is something that is still being investigated. So we are not sure how, and it's I think more common among young males. This is what the initial data suggests, and after the second dose, yeah. So this is something which requires further investigation. This is one of the real events which has been reported. But again, the risk is very low. Of the several millions of doses that have been administered, very about tens or less than few tens of cases have been reported. And another thing I noticed is that most of these cases had mild symptoms and could be managed, and were all managed well. So currently they don't see this as a, they don't recommend that you don't vaccinate. This is a risk. So I think every medical intervention, including vaccine, has benefits and risks, and it's for us to make a judgment, looking at both benefits and risks, and take a call. And so if, let's say, some vaccines have more, for example, the mRNA vaccines have more predisposition to developing these side effects, then we could choose another vaccine for the second dose. And that is why the studies on interchangeability of vaccines is all the more important. Because we've also seen, Covishield, for example, there is a side effect of coagulation, thrombosis, and thrombocytopenia. So these are side effects which people have experienced after the first dose. So they are hesitant to take the second dose.
Yeah.
And they want to use another vaccine, another kind of vaccine, for example, for the second dose. And that is why the interchangeability of vaccine studies are going to be very, very important.
Yeah. So to summarize, this sounds like any other medical intervention, vaccines may cause some heart problems in a very small percentage of people, but this should not be a reason for you not to get vaccine if you're eligible to do so. So if you're eligible, do get the vaccine. That's the message, right? So moving on to the next one. After first dose, if a person gets infected after some time, when should that person go for the second dose?
Yes, I think we've answered this. So if you are infected after the first dose, just wait for your infection to subside. Once your symptoms are okay and you've recovered, maybe you can go for the vaccination 3 months after that.
Okay. So I'm going to put the next question on the screen. So the question says, last 15 days I got COVID. If I got contact with a positive person, am I going to get it again? So it looks like recovery was 15 days ago, and then there was a contact with a positive person.
Yes. It's very unlikely that you will get infected again, because infection, the first episode, and you've just recovered. It's just 15 days, so there is some immunity. We do not know exactly how long the immunity lasts, but definitely, initial 3 to 6 months, it's very unlikely that you get reinfected, but it's possible, because we do not know what's the level of immunity the natural infection has accorded you, or maybe you are exposed to a new strain of coronavirus altogether. So it is possible that you get infected again, but the risk of I still hope the risk of severe disease and death will be quite low.
Okay. So sounds like
just wanted to add, Rajiv. So this is why it's very important that people do not think that, okay, now I'm vaccinated, now I can remove my mask, move around, I don't have to maintain physical distance. I don't think we can let our guard down. Yeah. So, because as I said, vaccines are not 100% protective. One, you may get infected, and even if it doesn't cause severe disease and death in you, you may affect the love your near and dear ones. That infection can get transmitted. Yeah? So, I think I heard a quote somewhere which is very very relevant. Nobody is safe until everyone is safe. Yeah? So
Great.
this is very very important. Yeah.
Yeah.
So just because I hear some recommendations that just because you are now fully vaccinated, you can move around without masks, without following distancing rules and other precautions, other COVID appropriate behavior we have been following. But I don't think that's a sound recommendation. Yes, if all the people in the world are vaccinated, then probably yeah, we could try some of those again.
Yeah. So interestingly, Ajay, I had a question. I had 2 doses of vaccines. Should I throw the mask? So maybe I should throw the question away, but not the mask, because people should still
Yes,
continue to wear the mask even after the vaccine,
absolutely. Yeah, yeah.
right? So I have another question. Um, so this says I was primary contact of COVID positive patient and I got tested 2 weeks back. Should I go for retest again? I got my both doses of Covishield before my test.
Yeah, it's fine. I think if you do not have symptoms and you are doing well, I'm assuming that, then I don't think you need to go and get tested again. Usually, if you are, if let's say you got exposed and got tested very early, maybe immediately, you may be negative, and then if you get tested after a while, once you develop symptoms, you may turn positive. That we have seen. But if you do not have symptoms, you've already tested negative ones. It's already 2 weeks. I don't think you need testing again.
All right. Uh, Let me see the next one. Um, so, I had a similar question that one of our viewers has posted. So it says, so let me ask my question and then combine that with their question. So there is a new vaccine, Sputnik from Russia now. So the question
Right.
is, how is this similar and different to other vaccines? And our viewer wants to know, according to you, which is the best COVID-19 vaccine? So now we have the choice of 3 vaccines in India.
Yes, we do have indeed Covishield, Covaxin, and now this Sputnik from Russia. And it's likely that we may also get Pfizer and Moderna into India. So we will have a lot of options for sure. Uh, so let me first answer the second question. Which is the best vaccine? Yeah. So if you look at studies, and every study will give what is the vaccine efficacy, and it can range from 66%, some say 76%, 81%, 91%, 94%, 95%. So these are the kind of things we get. Yeah? So what it is telling is that people who are vaccinated, they have a 95% lesser chance of becoming infected compared to those who are not vaccinated. Okay, so this is what it means. But what is more important for us? See, what is COVID infection? The symptoms are all like any other common cold. But just because in a small proportion of people, it can the disease course can take a severe course, make you hospitalized, and people die because of it. That is what is the real danger of COVID. So, and almost all the vaccines doesn't matter. Depend, whatever be the vaccine efficacy in preventing infection, almost all the vaccines are more than 95% effective in preventing severe disease and death. So really, whatever is available and easily accessible, just go and have it. So I do not recommend any particular brand, if
Hmm.
it's more effective than others. And I think CDC also does the same.
Yeah.
It does not recommend that you go for Pfizer or Moderna or Johnson and Johnson.
Okay.
Anything that's available. Yeah.
Okay. So that's helpful. So the best vaccine is whatever you can get easily and quickly. So it doesn't matter what brand it is, right?
Absolutely,
Yeah.
absolutely. And just to answer that question on the Sputnik vaccine, well, we have different kinds of vaccines. I've been talking about this. Sometimes you take the whole virus, kill it, inactivate it, and then give. That's the Covaxin from India. Sometimes you take the genetic material. So there are mRNA vaccines, and sometimes we use viral vector. So you use an adenovirus which causes common cold, and which is harmless, and use it to deliver the particular vaccine. So there are different kinds of vaccines. So Sputnik is also one of those viral vector vaccines, um, and they also use human adenovirus.
Mm-hmm.
Yeah.
Okay. Okay.
And I think the latest study that was published in Lancet it says that it has 91% vaccine efficacy. Yeah.
Do you mean the Sputnik vaccine?
Yeah, the Sputnik vaccine reports a vaccine efficacy of 91%, yeah, in preventing infection. But as I said, as far as preventing severe disease and death, all vaccines fare equally well.
Okay. So sounds like all the vaccines are more than 90% effective. Is that right?
I would say more than 95% effective in preventing severe disease, hospitalization, and death.
Okay.
Yeah.
Okay. That's great. All right. So our viewer has another question. Can normal person do breathing exercises? Is there any way that we can check we are safe from COVID-19 without actually testing for it?
Yes, normal person can do breathing exercises. In fact, in India we have a tradition of doing pranayama, which is nothing but conscious, deep, slow breathing technique, and that has been shown to be of immense benefit. Yeah?
Yeah.
So if you are doing that, this is you can do many things to boost one's immunity, which includes a well balanced, nutritious diet, physical exercise, anything that relieves stress, including meditation, pranayama, or good sleep, for that matter. All of them have been shown to enhance our general immunity. But
Hmm.
of course, vaccination is required for COVID specific immunity.
Yeah.
Yeah. So I forget that. Can you repeat the next part of the question?
Uh, yeah, but before that, I want to remind that I have a video on breathing exercise, so I have left a link in the description below. Do check it out. So
Wonderful.
the next part is there any way that we can check we are safe from COVID-19 without actually testing?
Yeah, I don't think we need to be in a state of panic. Yeah. So I think we know the symptoms of COVID. Follow all the COVID appropriate behavior. Stay home if you can. Avoid crowded places. Use the mask. Use it properly. Which covers your nose, mouth, the whole thing. And follow physical distance. So follow all the COVID-19 appropriate behavior. If you can learn some of these techniques of meditation and pranayama, practice them to enhance general immunity, get a vaccine, and in spite of that, if you develop symptoms, yeah,
Hmm.
fever, cough,
Yeah.
myalgia, body ache, then is the time I would say you should go and get tested for COVID to see if it's really COVID or not. Otherwise, there's nothing that you need to worry about.
Yeah. So before we get on the next question from the viewer, I have a question because we are on the topic of yoga and pranayama. So I
Right.
know a lot of fellow Indians take Ayurvedic medicines, Unani medicines, homeopathy, all the alternative kind of medicines. So if they're on any of these medicines, question is, can they still have the vaccine?
Yeah, I do not see any contraindication if somebody is taking Ayurvedic medicines or Unani or homeopathy for any reason, as a general immunomodulator or for treatment of COVID. I see many people also take these as sort of adjuvant treatments. Yeah, although the evidence base is quite weak in terms of whether they are really effective in curing COVID or not. But these are mostly recommended as adjuvant treatments, more as immunomodulators. So,
Mm-hmm.
for example, the Ministry of Ayush in India also recommends a couple of Ayurvedic medicines, more as a general immunomodulator in people with COVID, as an adjuvant to the main treatment that they continue to take. So that is fine because most of these medicines do not have adverse side effects, adverse events related to it. So people are recommending these as adjuvant. I have no objection whether people want to take it; it's their choice. And
Okay.
I do not think that as anything that goes against taking a vaccine, for example.
Okay.
It's
So,
quite safe to take.
so if people are on Ayurvedic medicine, Unani homeopathy, they can still take the vaccine.
Yes, absolutely.
Okay.
Yes.
Okay. So let's look at the next question from our viewer. Um, what is the reason some patients remain positive for a longer duration even after taking treatment?
Right. So again, this is one of those areas which is still being researched. Yeah. So there are a very small proportion of people who continue to be positive and shed the virus. Uh, I mean, there are two ways to look at it. One is the virus, the positive test. When we do a RT-PCR, for example, and find out the viral DNA. There is also a question whether it's live virus or a killed virus, which is still getting excreted from the body. Yeah? So that's the other complication there is. So they may be shedding virus, but it could just be a dead virus. Yeah? And RT-PCR as a tool cannot distinguish between a dead virus and a live virus. So yes, we do see in a very small proportion of people continue to be positive for a long time. Uh, but I think as long as you're clinically recovered, there's no problem. But continue to maintain COVID appropriate behavior in any case.
Yeah. Okay. So next question from our viewer, it might be on your screen as well. So the question is, could we please explain why people who have allergies should not take vaccines? What is your advice for people who have allergies?
Right. So I think we have to distinguish a little bit here. I don't think it's recommended people with any allergy should not take the vaccine. No. I think if you are allergic to the vaccine itself or one of the components of the vaccine, yeah, then I think it's recommended that you don't take the vaccine. And or for example, if you have used a vaccine sometime before and you have been allergic to that particular vaccine, and maybe it has the same additional content as this vaccine, then you have to be careful. So if you are, let's say there is a history of allergy or reaction to a previous vaccine, then I think you must be careful. Visit a place where they are able to give you a test dose and check if there is any kind of allergic reaction. So you must visit a facility where if there is an allergic reaction, they are able to manage. So they should give you a test dose and then check. And if there is no problem, then you can receive the vaccine. But any other allergies, like I am allergic to food, I'm allergic to pets, I'm allergic to dust, those are not contraindications for you to, take the vaccine. You can definitely take the vaccine. And I also heard some people, I'm allergic to eggs, and maybe eggs are used in these vaccines, so I should not take the vaccine. So just wanted to clarify, eggs are not used. I mean, egg proteins are not used in any of the vaccines, so it's quite safe.
Okay, so that's a good point. So you bring up the egg example. Is it because it's used in the flu vaccine?
Yeah, there is this, perception that vaccines use egg proteins,
Sure.
and so people who are allergic to eggs want to avoid it. Yeah.
Okay. So these COVID vaccines do not have any egg products in them or egg derivatives. All right.
Yes.
Next question is, what are the symptoms of black fungus?
Right, symptoms. So this mucormycosis, as it is called, this is an infection because of a fungus, and primarily seen in people who are recovering from COVID. And the two other things that is commonly present is, of course, use of steroids and uncontrolled diabetes. But we are also seeing, this infection in people who do not have this. So it's not that these have to be present, but if it is there, the risk is much higher. And the mucormycosis can occur, it can affect, what we call as rhinocerebral, which means it affects your nose, your sinuses, and then it can spread to affect your eyes and the brain. So that's one of the ways it can affect. It can affect the lungs, which is called as pulmonary mucormycosis. Can affect the GI tract, where it's called gastrointestinal, and it can also affect the skin, where we call it as cutaneous mucormycosis. Yeah.
Mhm.
So depending on where it gets affected, you will have that kind of symptoms. So, for example, facial pain more in one part of the face than the other, or pain in the eyes. Yeah. So if you have anything, or if you have lung infection, then again difficulty in breathing, and so on. So I think the key is to seek care as soon as you have these symptoms, and not to delay, yeah, or not to neglect, because the clinical course can be quite rapid and progressive. And I hear from my colleagues that many people, have lost their eyes, and require surgical procedures, and it's not it's a terrible disease to have.
Yeah. Yeah. Thank you for that information. Uh, all right. Moving on to the next question from our viewer. If COVID-19 continues for another 4 to 5 years, which I hope not, should we get the third and the fourth shot of the vaccine?
Well, okay. So I think at this point we do not have any studies which have looked at, about the need for annual booster doses. Do we require it? If required, what's the frequency? So these are questions which are not answered as yet. Yes, we can think of a possibility, because there are new variants, new strains of the coronavirus. Uh, and so, if let us say the current vaccine is not protective to another future strain of coronavirus,
Mm-hmm.
then we may tweak the vaccine a little bit, and if that is the case, we may require a booster dose. Whether it's going to be an annual booster dose that we need to take, or is it going to be once in 2 years, or as the new strains develop? I think these are all questions which are still yet to be answered.
Yeah, yeah. So to summarize, I think there is a very high likelihood we will need more shots, but it's not clear at this point of time how and when beyond those 2 shots that's required for the specific vaccines.
Right.
Um,
So I just wanted to add, I saw a study, I think a week or 10 days ago, which was looking at how protective are the current vaccines against the new variants of coronavirus. And what we saw was that they do have considerable protection. I think, I don't remember the exact, but almost about 70-80% efficacy to the new strain of coronavirus. And again, it's not what we are looking at is how effective they are in preventing severe disease and death. And on that count, they perform much better than in preventing infection.
mhm. Okay. So moving on to well, first of all, I want to thank all the viewers for being so interacting and asking so many questions. So this is fantastic. Um, So this is a question I had as well about children. So what about the
Right.
children's vaccination? Is the same vaccine or different? So before Dr. Ajay answers this question, I want to remind all the viewers. So we will be having a pediatric specific session, not about vaccines, but in general about children and COVID from 2 pediatric experts, one from the USA, one from India. Next Sunday, 9:30 a.m. US time and 7 p.m. India time. So stay tuned for that. All right, I'll let
Great,
Dr. Ajay answer
great.
this question.
Yeah, so should children get the vaccine? I think as of now, just because we have not tested all the vaccine studies have been done in adults and not children. So we do not know whether these vaccines are safe, they are effective in children. So the current recommendation, I guess, is that vaccines are not provided for children. But of course, I think the only vaccine that has been approved for use in adolescents, in people aged between 12 and 18 years, is the Pfizer vaccine in US. So this is the only vaccine I see which has been approved. No other vaccines have been approved yet for the children. So there are trials going on, and I also saw in the news in India that Covaxin is going for trials in children aged between 2 and 18 years. So yeah, we'll have to wait maybe another 3-4 months before we'll have more specific recommendations here.
Yeah, absolutely. Trials are on in the US, in India, and hopefully we have some results so more children can get vaccinated. Uh, so the next question is it possible to take Covishield one dose and Johnson next dose? So we do have viewers, maybe like jumping back and forth. So we did address this question, but if you want to briefly summarize what you said before, I think that would be very helpful.
Yeah, just to say one line, as of now, interchangeability of vaccines is not recommended or permitted.
Yeah. And on the same note, there are a lot of people who are traveling between countries. So the question is, let's say someone has Covishield in India, one dose, and then
Right.
decides to travel to USA, and now they have access to both doses of Pfizer vaccine. So should they be taking the Pfizer vaccine and forget about the Covishield, or what do you think? Those people should do.
Yeah, it's quite a tricky thing, isn't it? Yeah, so they've had Covishield. I would recommend they try and get a Covishield if it's available in US and fulfill that particular. So again, interchangeability of vaccines, we do not have adequate evidence yet. Once maybe in 3-4 months we have those studies all come out, maybe it's no problem to take a Pfizer or Moderna after Covishield. That's okay. But as of now, you must try and get this done. There's another nuance to it. So if you have done the Covishield in India and let's say you go to US, so US also has they define what is meant by a fully vaccinated person,
Mm-hmm.
and they currently in that consider only those vaccines which are either approved by the FDA
Mm-hmm.
or listed by WHO.
Mm-hmm.
Okay, so if let's say a person is vaccinated with some other vaccine which is not on that list, so I think the three vaccines in US which are approved by FDA are Pfizer, Moderna, and Janssen.
Mm-hmm.
Yeah, these are the three.
Yeah.
In addition, I think the WHO also acknowledges in its list Covishield, which is the AstraZeneca vaccine, and Sinopharm or Sinopharma, which is a Chinese vaccine.
Mm-hmm.
So these are the five vaccines which are sort of there on the WHO list and are approved by FDA. So
Yeah.
US only considers these. So if let's say I get a vaccine which is not, let's say I get co-vaccine,
Okay.
yeah, as of now, and then go to US. US does not consider that I'm vaccinated.
Okay. Okay.
Yeah, so there's this nuance depending on each country. Or, for example, Sputnik vaccine for that matter.
Uh-huh.
It's neither approved by FDA nor is it in the WHO approved list. Yeah?
Uh-huh.
So if I get Sputnik vaccine in US, they may not consider I'm fully vaccinated.
Mm-hmm. Mm-hmm. Well, the best part is I saw like a WhatsApp ad saying travel to Russia, get 2 doses of Sputnik vaccine or whatever it is. I don't know if it's true or not, but I did see that. Anyway,
Yes, I did see
uh,
that too.
next question from the viewer. So, hi doctor, how much time does it take to show the symptoms after infection in a healthy person?
Right, I'm trying to understand this question.
Uh,
So
how much time does it take to show symptoms after probably exposure?
exposure, yeah, maybe after exposure, I guess. So the median incubation period is about 4 to 5 days. Yeah, but so which means that after exposure, most of them, some may develop as early as 2 days, but many develop within 7 days. But we have seen people developing symptoms up to 14 days. So this is usually the range of incubation period, 2 to 14 days, and the
Mm-hmm.
median is anywhere average is about 4 to 5 days. Yeah. So let's say after you get exposed, you don't get develop any symptoms, and so that is how the period of quarantine is also recommended. Is about 10 to 14 days. Is in most countries people recommend that after exposure, in case there is a risk, you quarantine yourself.
Mm-hmm. Uh, moving on to the next question from our viewer, it says, as of now in India, there are only two vaccines, a Covishield and Covaxin. Why is there no third vaccine? Is it so difficult to invent new vaccines? I think you already addressed this, but if you want to give a one-liner, that would be very
I,
helpful.
Yeah, very quickly, I think Sputnik is already there, I see, and Pfizer and Moderna are going to expected to reach India soon. So yeah, we will have a lot of options.
Okay. So next is, please share your views on third wave. How many more variants?
I think historically we all know that these come in waves. Yeah. So will third wave happen? When will it happen? I cannot predict this. It's very likely that a third wave will happen. When it is going to happen, how strong it will be, how many people will be affected, I think nobody can predict. It all depends on how well we act now. Yeah. So if we are, if we can vaccinate the whole population or a substantial proportion of the population to cut the transmission, cut the chain of transmission in the, let's say, in the next few months, then there will be very few susceptibles left, even to have a third wave. And even if a third wave happens, then it's going to be a very small wave which we can easily manage.
Mhm. All right. So we have another question from our viewer who says, does using home remedies like turmeric powder, ginger, black pepper effective for someone who is affected with COVID?
Well, I think we've answered in that question on Ayurvedic medicines and Unani medicines and so on. So, all the traditional home remedies, do we have evidence that they can kill coronavirus and cure you of the infection? Of course not. But am I going to say to you that not to do this? No. Please continue to do this, whatever effects they have. I mean, the thing is, they do not have any adverse effects, and it's part of our tradition, part of our diet. So please continue to have them. But don't expect that doing that, I will not get infected with COVID. And don't be under a false assurance and stop following COVID appropriate behavior. I think
Yeah.
that's more important. And when you get a vaccine, please take it.
Yeah. Uh, so sounds like if it's a part of your normal diet, you like the taste of it, do it, but just don't overdo it just because it's going to do some magic for COVID. It will not.
Yeah.
So vaccine is the way to go. Uh,
Vaccine and COVID appropriate behavior, I think, should continue. I
yeah,
must emphasize. Yeah.
absolutely, absolutely. Well said. Uh, so this is an interesting question. Can we make any medicine in home for COVID-19?
I'm not sure I can answer that. I do not know what medicine you want to make at home. As I know, I do not know of any medicines that we can prepare at home to kill coronavirus as of yeah.
So I guess it comes to the same thing about the Ayurvedic treatment, homeopathy. If you like the taste of something you're putting in your food, just continue it, but just continue your normal COVID behavior.
Right.
So the next question is, what's the validity period of this vaccine? Any vaccine, I guess.
Yeah. So again, how long is this going to protect us? Again, it's unclear. Yeah. So the studies I think have been completed 6 to 9 months now. We are probably a follow-up results of the same studies will let us know how protective they are with the extended duration of follow-up. But I think as of now we do not have answers for this question. Do not have a clear answer. 6 to 9 months is what people say, but how strong is the protection is also unclear.
Hmm. I have a question. People take these vaccines, then they have this high degree of fever, headache, all kinds of symptoms. They were feeling perfectly fine, but now they have the vaccine and they have all kinds of symptoms. So, why did that happen? Did someone get infected, or what is that about?
Right. So, I mean, what you said about fever, body aches, and headaches, these can also happen as the body tries to mount an immune response. Yeah. So
Mm-hmm.
this is part of the body's reaction. So these are some of the common side effects that have been reported due to the vaccine itself. Yeah.
Yeah.
So I think take good rest, take symptomatic treatment, take a paracetamol if you have high fever, body ache. That's one of the safest painkillers that we have.
Mm-hmm.
So just treat symptomatically, take adequate rest, and you should be fine. But let us say these symptoms persist, yeah, maybe 2 3 days, still it persists. It is quite possible that this could be an indication of a COVID infection. Yeah? It's not that the COVID vaccine gave you this COVID infection. It's
Okay.
more likely, I mean, the COVID vaccine cannot give you COVID infection.
Okay.
Let's clear that out of way. So it's possible that you were exposed to somebody with COVID and you're not aware of that. Yeah, well before you got vaccinated. And as I said, vaccination is not instantly protective.
Mm-hmm.
You have to get both the doses and 2 weeks after that to get peak protection.
Mm-hmm.
So if you get exposed during this time, anytime, so you can get a COVID infection.
Okay. So people should expect getting some kind of reaction after getting a COVID shot. That does not mean COVID infection, but it just means the body's normal reaction or the response to
Yeah,
that vaccine, and just treat it symptomatically. If you have fever, just take paracetamol.
yeah, good. Yes.
So the other thing is, what if someone needs a separate vaccine? The common example I can think of is someone falls down, let's say they need a tetanus shot. Uh,
Right, right.
Now they also need a COVID shot. Let's say it could be the second dose, or they just had a
Hmm.
COVID shot like 2 or 3 days ago. So how will that go? Is that okay to still get additional vaccines?
Yeah, I think it should be okay to get vaccine. I think maybe a month ago or so, the guideline was that about co-administration of vaccines. It was recommended that no other vaccine should be administered 2 weeks before or after the COVID vaccine. But I think that was more not based on any data as such, but more of just to be safe and being overcautious, I would say.
Okay.
But I think that recommendation no longer holds true. I think CDC now recommends that co-administration of vaccines is fine.
Uh-huh.
Again, I did not see any data even in support of this. But this is the current recommendation. So if you want to take a tetanus shot, just and you want to take both on the same day, you have to take then maybe take tetanus shot in one arm and the COVID vaccine in another arm. Yeah.
Okay, okay. So that's a good tip. Yeah, that's very helpful. All right. So let's see. Um, so the next is tested COVID positive in rapid antigen test and tested negative in swab test after 2 days. So the question is,
Oh,
I did not understand how did this happen. I'm sure you're not the
I
first
do.
person who is having this.
Yes, I think it's it's difficult to explain. Sometimes all these tests that we are doing, we cannot say they are 100% perfect. Yeah, and, and anything can happen. Just in the way the swab is collected, the way the sample gets processed, the way it's conducted. In a lab, the way the results are shared. So there could be errors along the path. So it's very difficult to explain why somebody who gets positive. But I have a question for you. Normally, if you get positive with an antigen test, it is not recommended that you get a swab test with using RT-PCR. I don't know why you got that test. Maybe you wanted to confirm you were not sure. But normally, it's not. Only if it's negative, antigen test is negative, do we recommend that you go for RT-PCR to confirm if you're missing it.
Yeah. I also want to mention that if you are tested positive, it is very possible that you may be staying positive for at least 3 months, sometimes up to 3 months after the initial test results being positive. And this is because of continued viral presence in the respiratory tract. But after 14 days, you would still not be infective, even though you're continued to be tested positive.
Right, right.
All right. So let's ask the next one. So, is there any global effort for single vaccine approved by all countries?
So there are many vaccine candidates. So will we ever reach a stage where one vaccine will be recommended by everyone in the world? I don't think that's the case. There are several vaccines which are available, and most of them are quite effective, equally effective, I would say. More or less, more than 95% effective in preventing severe disease and death. Yeah. So on that count, I think we should be fortunate that we have so many options because, you know, sometimes what happens is in a specific subgroup, there might be a risk of some of the, like we discussed about thrombosis, yeah? And we discussed about myocarditis and with reference to some vaccines in certain subgroups. If that is the case, yeah, then we always have a choice of another vaccine that we can resort to. So it's good that we have plenty of vaccines. I think I'll just maybe mention a point. I think what is more important and very much required today is if we can get a single dose vaccine.
Mm-hmm.
Right now, we know 2 doses between 3 weeks, 4 weeks, 12 weeks. We'll have to wait to achieve peak protection. But
Yeah.
if somehow we can get the same level of protection in one dose, I
Mm-hmm.
think that will be great. Yeah.
Yeah.
And the only vaccine I see with the single dose currently is Johnson and Johnson. So that's there. But I think others are also coming up. I hear Sputnik is coming up with a single dose vaccine. Many other candidates being developed too.
Yeah. Okay. Great. I have a question. Can a pregnant lady receive the vaccine? And if they did receive the vaccine during pregnancy, is their newborn baby protected because of this vaccine?
Yeah, very good, Rajiv. So, pregnant and lactating, I think increasingly it's being acknowledged that if pregnant women get infected with COVID, they are more likely to have a severe illness for themselves.
Uh-huh.
And also, there is a higher risk of preterm birth and other problems for the child. So, I guess it's. I think more and more people are acknowledging that it's safer to provide, vaccine to pregnant women and lactating women.
Uh-huh.
Although it's not yet recommended universally. So, for example, in India, I don't think the government of India is because there are basically because again we do not have trials conducted on pregnant and lactating women
Mm-hmm.
uh, to be uh, to be reassured that we can provide the vaccine. So I don't think it's currently recommended by the government of India yet.
Mm-hmm.
But many of the professional bodies have recommended. I think CDC also now recommends vaccination to pregnant and lactating women. But of course, it's really the choice of the pregnant woman. So they have to assess the risk, assess the benefit, and then make a choice for themselves whether they want to get vaccinated or not. I think whatever initial data which CDC has been monitoring, real time data, not from trials, looks that it shows that I think it's quite safe. The incidence of adverse events is not greater in pregnant women compared to non-pregnant. So in that sense, it's quite reassuring. I
Mm-hmm.
think more and more people are coming around to the fact and more comfortable in recommending that pregnant and lactating women should be vaccinated.
Okay.
Coming back to your question about will the children be will the child be protected? Well, I think there is some research to show that antibodies can be transmitted from mother to the child during pregnancy, during lactation as well. So it may provide some protection. Yeah.
Okay.
So early days, we are yet to get concrete data on this, but yeah, there is a possibility because the antibodies themselves have been isolated from breast milk and so on. So
Okay.
it definitely may provide some protection.
Okay. So sounds like, to summarize, if you're pregnant, if you're breastfeeding, you can still take the vaccine as long as you're okay doing it. Will it protect your child? The answer is not clear yet, unfortunately. Maybe it does, so the data will be out soon, and hopefully we will have an answer about that. But until then, if you're positive, do continue the usual precautions about keeping your baby safe.
Yeah.
Um, all right, so we do have a question actually. Can we take the tablets after getting symptoms without testing for COVID?
What tablets? The question is a little bit unclear because there are no tablets as such specific for COVID. Yeah, all treatment that we are giving is really for symptoms. If you have fever, of course, take a paracetamol. If you have congestion, then maybe some antihistamines, and so on and so forth. So really, even the other treatments that we give, if you have severe symptoms, difficulty in breathing, drop in oxygen saturation, maybe we go for some oxygen therapy, or if it requires further ICU and so on. So really there is no specific treatment as such for COVID-19.
Mm-hmm.
So yes, if you have got any other flu or anything, of course you can take symptomatic treatment, not a problem. But if you want to find out if it's COVID or not, I think the only way you do it is by getting tested. No need to panic because most of them will have a mild course. Get tested, monitor your oxygen saturation, monitor your temperature, maybe pulse rate, respiratory rate. I think you should be fine. If those parameters are all within normal limits, then it should be fine.
Okay. So yeah, while waiting for if you're still not tested for COVID, yeah, do continue taking treatment for your symptoms, and also make sure you maintain the appropriate COVID precautions, which include social distancing and other things. So I have another question which says, when can we expect safe vaccination for kids?
Well, I think the studies are on in India and elsewhere. So we'll have to, I guess, wait for the results of these studies. I don't know when, maybe 3 months, 4 months, 6 months. Yeah.
Uh, so you do have a lot of expertise in low middle income countries, Dr. Ajay. You know,
Okay.
we have focused a few things about the Indian vaccines, and but our neighbors like Nepal, Bangladesh, Pakistan, our far neighbors, Africa, parts of South America, and just to name a few. And there are many other countries who have been affected with the same problem of these vaccine related issues and shortages. So, do you have any advice for them, or do you say anything different to them?
Well, I think overall, India is in the midst of the second wave, which has been horrible, to say the least. I think other countries should take lessons from what has happened in India and some other countries of Europe, which have faced this crisis already. So preparation is going to be the key. Prepare the health systems well in advance. Do not, I think educating the public to follow COVID appropriate behavior is a key intervention which people have to do. And vaccination, I think, is one of the most effective interventions we have against COVID 19. So other countries should try and vaccinate their populations. So do not be complacent. Do not neglect. Do not think your populations are somehow immune to COVID. This is how many people thought and are paying the price for it. So I don't think these countries are in any way different, Rajiv,
Okay,
to India. So I think the interventions as the public health interventions are going to remain the same. Yeah.
okay,
Follow COVID, educate the public to follow COVID appropriate behavior, vaccination. We all have to pool our resources so that and get a large proportion. How much? Well, people talk of 70%, 80%. Nobody is sure to as to what proportion of the population should be immunized before the herd immunity can kick in.
hmm,
But I guess that's one of the most effective interventions that we still have.
okay. No, that's great. Um, so the same principles apply for all countries, because everybody is going through the same pain with regards to the
Yeah.
vaccine. So I do have a question from the viewer, which says, "Tell about any food restrictions after the dose of any vaccine."
Yeah, I don't think there are any food restrictions as such with vaccination. In fact, none that I can think of. There are no recommendations about what to eat, what not to eat. Yeah.
Okay, so
Continue
just
to follow your
continue.
well
Yeah,
balanced, nutritious diet because that is a function of that's one way you can improve your general immunity.
yeah. In fact, I have to say, if you develop any symptoms after vaccine, it's important to continue the diet and make sure you get hydrated, because you don't want to, go dehydrated just because you have fever, you're unable to drink or eat or something like that. So do continue your normal diet, and continue your healthy diet, actually.
Right.
So, we have a lot of people who have a lot of different problems. High blood pressure, sugar issues, diabetes is so common. There are many
Mm,
people with heart disease. There's so many people with thyroid disease. Unfortunately, some people have cancer, and there are many
mm,
other problems. So, is it
right.
safe for these group to get the vaccine?
A short answer, yes. I think all these groups, in fact, it's safe to get the vaccine, and in fact, it's very important that these groups are prioritized to get the vaccine, in my view, because these are the people who are at higher risk of severe disease, hospitalization, and death.
Okay,
So people, with all these things that you mentioned, should be, in my view, should be prioritized to get the vaccine. I
okay,
think in terms of contraindications, we talked about allergy to the vaccine or some of its components, or we said currently children, for example, we do not yet have the data, so they are out of the vaccination group. Pregnant and lactating women in some countries are still thinking, but I think soon they are also out of the group. But in a sense, most people can get vaccinated, other than the three groups that I mentioned.
Hmm. So, you know, the last time I read the newspaper, like especially about the number of strains, there were like about 800 strains that were identified in India. I'm sure there are more now. So,
Wow.
do these vaccines, I mean, one or two of them have been more, dangerous, but do these vaccines protect against these variants of coronavirus?
Yes, so I think there have been some data coming forth on this. So, as I mentioned earlier, the current vaccines seem to provide some amount of protection against the newer strains of coronavirus. Uh, uh, is it the same as what has been tested before? No, it's a bit lesser. So, for example, I think we had some data from Pfizer. The initial data showed about 95% efficacy, and against the new strain, it was much lesser, 80% or a little less than that. But again, that even 80% protection is substantial protection in my view. Yeah. So it's not that the vaccine is not at all effective against the new strains of coronavirus.
Yeah.
There is some protection to be accorded, and in my view, it's not trivial. Yeah? 80% or 75% protection is good protection. Yeah?
Hmm.
By on any day, I will take that. And once again, it's in protecting against severe disease and death, it's slightly better than in protecting against any infection. So in
Okay.
that sense, also the current vaccines that we have seem to be fairly considerably good protection against the new variants as well.
Hmm. So for people watching this, they should not worry about the strains and whatnot and stuff like that. So if they get the vaccine, they should try to get the vaccine as soon as feasible, and just continue with the usual precautions until then.
Absolutely, yeah.
So let me check if there are any more questions. So I don't see any more questions. I think this was a very lively interaction. So I do want to remind all the viewers to do hit the subscribe button if you're still not subscribed, so you get a notification when I release a new video. And thank you for watching. I want to very heartfully thank Dr. Ajay, who is very busy but really has spared his time to answer all these very important questions. Uh,
Thank you so much, Rajiv, for this opportunity. Great catching up with you, and you did a great job summarizing whatever I said.
yeah.
Thank you.
Yeah, thank you. Thank you so much. And take care. Bye.
Bye bye.